Maybe noticing it at work, fewer people are getting sick, and there are new promising numbers when it comes to COVID-19 in our area. Joining us to talk about it, Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. Doc, great to see you. Numbers from Milwaukee County show we are right on the cusp of being what is considered low, right?
Right, and so the numbers in Milwaukee County actually are kind of striking to me because it's not looking at number of cases overall or testing. It's actually following and tracking hospitalizations. And we've seen throughout Wisconsin this trend downward of hospitalizations due to COVID. And especially in Milwaukee County now, you're seeing it onto that threshold of low transmission. That's a tremendous feat for an urban community.
How's the whole state doing? I know you're in Dane County. Are we making progress statewide?
We're making a very good progress statewide. I think we have pretty good immunity throughout our communities. People have been exposed either to the vaccine, COVID, or both. And that the high level of immunity is really protective and has done a great job of keeping people out of the hospitals.
Hey, if you don't have health insurance, listen up to this because Moderna making some news this week, right?
Right. So Moderna had originally come out and suggested that as the vaccine will be paid by commercial insurance companies, that the cost of the shot would be somewhere between $110 and $130. We already have enough problem with uptake of the vaccine rather than having an exorbitant price on it. And so the fact that they have now come out and said that they will make sure that the vaccine is available to anyone who wants it, regardless of their ability to pay for it, I think is a huge step forward and really develops an even playing ground for everybody as we fight COVID-19 into the future.
Yeah, especially since a lot of tax dollars were spent to help develop these vaccines.
Absolutely. I think there is a certain moral obligation to these companies that have collected these tax dollars over time to really give back to the communities that helped fund this research and get things to this point.
Okay, quickly here, if you have diabetes, you may have extra incentive to make sure you get up to date with your vaccine. What's this new study show?
Well, in families where diabetes has a history, if people who didn't previously have diabetes contract COVID-19, and it doesn't, the study didn't show how many times they had COVID, if it was just a single time or multiple times, but the chance of developing diabetes in these people increases by almost 60%. And so we know that COVID does bad things to your internal organs and can do that for a long time. Your pancreas, in this case, definitely takes a hit by COVID, and the chance of developing diabetes greatly increases.
Eye-opening study for sure. Dr. Bill Hartman from UW Health, appreciate your time.
Thank you.